As we get older, it's pretty normal to forget a name here and there, misplace our glasses, or walk into a room and completely forget why we're there. We've all done it. But sometimes, these little memory hiccups can be an early sign of something more serious, like mild cognitive decline or even dementia. In today's video, we're going to explore how to recognize those early warning signs. And more importantly, we'll dive into what you can do to protect your brain health and stay sharp for years to come. First, let's understand what we're talking about. Cognitive decline simply means a gradual loss of memory, attention, or your ability to think clearly. It's not always dementia. In fact, many people experience something called mild cognitive impairment, or MCI, which doesn't always lead to more severe conditions like Alzheimer's disease. The absolute key here is awareness. Knowing what is a normal part of aging versus what isn't can make all the difference in getting help early. As a neurologist might put it, normal aging can affect how fast we recall things, but dementia fundamentally changes how we understand and manage our daily lives. So, what are those early red flags we should be watching for? One of the biggest is frequent memory loss, especially forgetting recent conversations or finding yourself repeating the same stories over and over. Another sign is having new difficulty with familiar daily tasks, like managing bills, following a recipe you've made 100 times, or keeping up with household chores. Confusion about time or place is also a major indicator. This could mean losing track of dates, seasons, or even getting lost in a neighborhood you know well. You might also notice problems with language, like struggling to find the right words for simple objects or having trouble following a conversation. Finally, pay attention to significant changes in personality or mood. This could look like sudden withdrawal from social activities, unusual irritability, or new feelings of anxiety or depression. If you notice several of these changes, either in yourself or in someone you care about, it is a good idea to have a conversation with a healthcare provider. Now for the good news. There is so much you can do to support your brain health, and you can start today. First up, stay physically active. You don't need to run a marathon. Even light daily movement, like walking, stretching, or dancing improves blood flow to the brain, which is crucial for its health. Think of it as nourishing your brain from the inside out. And speaking of nourishment, what you eat matters immensely. Feeding your brain the right foods can make a huge difference. A diet rich in omega-3 south, which you can find in fish like salmon, along with plenty of leafy greens, berries, and whole grains, can significantly support cognitive function. The Mediterranean diet is a great example of a brain-healthy eating pattern that studies have shown can reduce your risk of cognitive decline. It's not about restriction. It's about adding more of the good stuff. Next, challenge your mind. Your brain is like a muscle. If you don't use it, you risk losing it. So, find activities that make you think. This could be anything from puzzles and reading to learning a new language or musical instrument. Even learning how to use new technology can create new neural pathways. Your brain thrives on novelty and challenges, so keep it engaged and curious. Another incredibly powerful tool is staying socially connected. Loneliness and isolation can actually speed up memory loss. Make an effort to connect with others. Join a club, volunteer for a cause you care about, or simply make it a habit to call friends and family regularly. These social interactions are stimulating for your brain and incredibly beneficial for your overall emotional well-being. Don't forget the basics: sleep and stress management. Poor sleep and chronic stress are toxic to your memory. When you sleep, your brain works to clear out waste products and consolidate memories. Aim for a consistent sleep schedule. To manage stress, find what works for you. Maybe it's deep breathing, meditation, or spending time in nature. Limiting screen time before bed can also help improve your sleep quality. And finally, make regular checkups a priority. Talk to your doctor about cognitive screenings especially if you have conditions like diabetes or high blood pressure, or if there's a family history of dementia. These screenings are simple, non-invasive, and can catch potential issues early. So, when is the right time to seek help? The simple answer is, don't wait for symptoms to get bad. An early evaluation is so important. It allows doctors to rule out other reversible causes for your symptoms, like vitamin deficiencies, side effects from medication, or thyroid issues. If it is early cognitive decline, getting a diagnosis sooner means you can start implementing lifestyle changes or treatments that can help slow its progression and maintain your quality of life for longer. Your brain is truly your greatest gift, and it deserves the same care and attention you give to the rest of your body. By staying active, eating well, staying connected, and being proactive about your health, you can work to preserve your memory, clarity, and independence well into your golden years. If you found this video helpful, please give it a like and consider sharing it with your friends and loved ones. And for more trusted advice on aging well, don't forget to subscribe. Thanks for watching.